Hello viewers, welcome to Uron, and we are in special conversation with a doctor, and he is from Jaipur, a very prominent urologist. So sir, before starting anything, I'd like to request to you to please introduce yourself to the viewers.
I am Shivam Priyadarshi. I am heading the Department of Urology at Savai Mansingh Medical College, Jaipur.
Wow. Okay, sir. So the first question will be from overactive bladder. So overactive bladder is a very prominent problem which can be seen in most of the males and most of the females also sometimes.
Exactly.
But after some kind of age, this problem start misleading. So I'll be asking the first question, that can you please describe for the audience viewing this, that what is an overactive bladder and how does it impact the quality of life of a patient?
See, overactive bladder is a syndrome
Yeah.
which consists of frequency, urgency, and sometimes urge incontinence. So
Yeah.
it can be divided into either dry OAB or a wet OAB.
Dry.
So wet OAB is when it is associated with incontinence, when the person is leaking also during that urgency. So
And
it's
what is dry one?
dry is when there is no leak. It's just frequency and urgency.
Okay.
So the patient has to pee every now and then, and when she ever has an urge, she cannot stop. She
Yeah.
has to go to the bathroom immediately. So that's a dry OAB.
Okay, sir. What are the cons of delayed diagnosis in this case? Can you please share with us an example where the patient with overactive bladder delayed their visit to the doctor, and what was the impact on the patient?
See, many of these patients are misdiagnosed as a urinary tract infection also, because
Yeah.
many of them would have frequency urgency and sometimes even associated with dysuria. They may be treated with antibiotics and all that, which may not cure the problem, because it's a syndrome which continues if you are not actually counseling the patient properly, you are not doing the proper treatment, this will continue even after giving an antibiotic therapy. So
Yeah.
it's and if it continues for a long time, then it becomes a chronic kind of a overactive bladder, which need to be treated with not only drugs but also lifestyle changes.
Okay, sir. Then what lifestyle changes do you suggest as a doctor?
See, many of these patients need to be counseled according as per their fluid and diet management. So they have to take fluids at regular intervals, not very excessive amount and not very small amount also. So a small amount of urine may be causing some burning or acidic urine, which gives rise to urgency.
Yeah.
And if she's taking excessive amount of fluid, then again it will result in frequency. So fluid intake is a very important part. Then the diet. Diet is like if she has to avoid all kinds of irritant food like mirch masala, tali huई
Okay,
cheezeं,
yeah.
and then
Spicy.
smoking, spicy food, then smoking, tobacco, cold drinks, more of tea and coffee, nicotine, etc. All these are bladder irritants. They will increase these symptoms. And plus then we have to treat them some behavioral therapy in the form of Kegel exercises or pelvic floor exercises or some distraction techniques where you distract. Whenever you feel an urgency, you will ask them to distract themselves and involve them in something else, so
Yeah.
that moment of urgency goes away, and then she can continue without having that urinary frequency or urgency. So behavioral therapy, lifestyle changes, diet and fluid management are very important part in the management of overactive bladder, besides the drug treatment, pharmacotherapy.
Yeah. So, sir, in most of the females, one more problem can be seen, that is UTI. So, the next question is related to the UTI itself. Will you prefer urinary alkalizer with cranberry to treat UTI associated with kidney stones?
See, many of these urinary tract infections will have urinary pH which is high. So
Hi.
many of these organisms are protease type of organisms. If you give alkalizer, then it may rather increase the chance of infection. So you have to understand which organism is there, and if it is urinary tract infection with your protease-like organism where already they would proliferate in alkaline urine, you should not give alkalizer. So you have to consider which type of urinary tract infection, and not every patient would require alkalizer.
Okay.
Cranberry, yes, a patient who has a chronic urinary tract infection, cranberry has some role in preventing recurrent urinary tract infection. But it is not a very established kind of a treatment.
Treatment.
Yeah.
Okay, sir. Thank you so much for sharing your thoughts with our
Yeah.
viewers. We loved
Thank you.
enjoying this video.
Thank you. Thank you very much.